Hello everyone, today we will talk about the Glasgow Coma Scale. It is a clinical tool that is used to assess the consciousness of a patient after a head injury or a brain trauma. It measures the consciousness based on three parameters: the eye opening response, for which a maximum of 4 points are given, verbal response, for which a maximum of 5 points are given, and motor response, for which a maximum of 6 points are given. While calculating the Glasgow Coma Scale, the maximum score a patient can attain is 15, and the minimum a patient will be able to attain is 3. That is 1 for each of them. Glasgow Coma Scale is never 0. Along with that, while calculating the Glasgow Coma Scale, it is always the best response that is considered, the best response. Now looking further into each of these parameters, the first we will talk about is eye opening response. For all of these responses, we are going to move from the worst response to the best response. So the eye opening response is no eye opening. Its 1 point is granted to such a patient. Eye opens to pain is when we give the patient 2 points, and eye opening to verbal command or speech is 3 points, and eye opening spontaneously is 4 points. How do you remember this? It's quite easy if you're moving in an order, but if still you find it difficult, so you can remember, for example, there's some of your friends sleeping, right, and they are in a very 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 deep sleep, and you're trying to wake them up and they're not responding to you at all. That's score 1. Since they're not moving at all, they're not responding at all, what you do is like you slap them across the face as fun, or maybe you pinch them, and that's when they open their eyes, so they're responding to pain. That's that's when you give the patient 2 points. Further moving on is you will not apply any pain if they will be responding to you verbally, right? That is, you call their name and they wake up. That's score 3. And finally, the eyes are opening spontaneously. That's score 4. Then there is the verbal response, for which a maximum of 5 points are given. Sorry, I missed 1 point. If there is massive edema around the eyes, there's bandage applied, how will you check for the eye opening response? You will not. That is referred to as a NT, that is non-testable. That's not something we cannot test, right? Then there are verbal responses, for which a maximum of 5 points are given. A no verbal response means 1 point. If there are incomprehensible sounds or speech, like just incomprehensible sounds are being made by the patient, 2 points are given. Inappropriate responses are there, there's inappropriate response, or maybe their patients are, this is usually the case scenario where the patient use abusive languages and all, so that's when we grant them 3 points. And the 4 points are given when the patient is in a confused state, right? They're answering your questions, but you see that they are confused. And 5 is when they're, of course, oriented to the time, place, and person. Now, if there is a endotracheal tube inside the patient's throat, right, you will not be able to check their verbal response, or the patient cannot speak, then also you will not be able to check their verbal response, and again that will be a NT, that will be non-testable. To remember this, I've thought of a scenario. For example, one of your very young cousins, is angry with you because you didn't play with them, right? Or you refused to play with them. So now they're angry with you and you're trying to make up to them. So since they are angry with you and they're not talking to you, when you're going to call them, there's going to be no response, right? So that's the minimum score you have right now to attaining your goal at this moment, that is to make up to your extremely young cousin because you didn't play with them, right? So that is 1 point when they're not responding at all. Then you bring them some toffees, right? Their favorite toffees. They're like just making some incomprehensible sounds like like no, right? So that's 2 points. There's a little progress, but you're still not at the best. Then inappropriate responses is something they don't do, right? That's like this is when a patient is abusive, as I've already told, right? Inappropriate responses or inappropriate language is used by the patient. You can remember this by maybe that when you were giving them their chocolates, they try to push you, right? That's certainly not acceptable. That's something that's quite bad, right? So just relate it to that. And then you bring their favorite toy as well along with the chocolate, so now they're confused if they should spare you or not. So that is score 4. And finally you bring one more toy for them along with the chocolate, so now they're very happy and oriented with you. So that is a score of 5, the maximum score. And we already know what's an NT, non-testable. If there's a ED tube or the patient is mute, that's non-testable. Or any other case scenario where you cannot check for their verbal response. Then we have motor responses, for which a maximum of 6 points were given. 1 point is when there is no motor response. 2 points are given when there is extensive response, and this is referred to as decerebrate posture or position. 3 points are given for abnormal flexion, which is a decorticate posture. When the patient withdraws from the pain, that's when we give them 4 points. And purposeful movement to the painful stimulus is 5 points, and obeying the commands for the movement is 6 points. Let's go back to the sleeping scenario. All right. So what you do is, like, the first one is like there's no motor response or no response at all. You're trying to wake your friend up and there's no response. Score 1, no motor response. But right now we're not talking about the eye opening. No motor response. Then the 2 points are given. We said that when there is extensor response. Now extensor is decerebrate posture. So like you're irritating the sleeping person, so they're gonna, for example, push you off the bed, right? So for that they have to extend their upper limb to push you off, right? So that is extensor response, and it's a decerebrate posture. If you have read it in physiology or anatomy maybe, it's a decerebrate posture. Then there is, after pushing you off, they have to bring their arm back to the midline, right? And that's abnormal flexion. That's a decorticate posture. You can google these positions and look at them. In a decorticate posture, the upper limbs are very close to the midline, and in decerebrate the arms are extended, completely extended, right? Then we move further, that you're still not over the task of waking them up, so you try again. So now what they do is they move further away from you on the bed, right? So withdraws from the pain, that is when we grant 4 points. And finally you're not giving up, so finally they're like, okay, I'm gonna wake up now, right? So they will turn towards you and look at you with anger, right? So purposeful movement to painful stimulus. This is, for example, you do the trapezial pinch, right? You pinch their trapezius and they move their hand towards the painful stimulus, right? They hold your hand, right? Because I'm talking about the patient, right? Because the trapezial pinch caused them pain and they localized their pain. They're localizing their pain, so that's when we give 5 points. And when they are obeying the commands for movement, that's when we are giving them 6 points, right? Obeying the commands for the movement. Or if you will remember it in a chronological order, it is quite easy to remember because all makes sense. It's one step ahead of whatever you thought before. The whole scale. But if you find it quite difficult, you can think of some case scenarios like I said and remember it. But it is a very, very important score to assess the consciousness of a patient after a brain injury. And we missed, if there is paralysis, the motor response is non-testable, right? If there's paralysis, the motor response is non-testable. And we said already, severe brain injury is a score between 3 to 8 points. Moderate brain injury is 9 to 12, and minor brain injury is 13 to 15. If there is severe brain injury, you always have to secure the airway of the patient. This is very important. That's all for today. Thank you so much, guys. If you like it, please do like, share and subscribe. Thank you everyone. Good luck.